Imagine waking up one morning and hearing that the health coverage you depend on is about to change in ways that could affect your wallet, your doctor, and even the medicine you take. That is exactly what millions of seniors in the United States will face in 2026 as major reforms reshape Medicare Advantage. For some, this may feel empowering, for others, alarming. Either way, it is too important to ignore. Today, let's break down what Medicare Advantage in 2026 will look like, why it matters to you, and what choices you will need to make. Medicare Advantage, also known as Part C, is the private alternative to traditional Medicare. Instead of being managed directly by the government, seniors can choose to get their Medicare benefits through private insurance companies approved by Medicare. These plans have become increasingly popular because they often bundle extra benefits like dental, vision, hearing, transportation services, or wellness perks that original Medicare does not always include. As of today, over 30 million Americans are enrolled in Medicare Advantage, making it the fastest-growing part of Medicare. But starting in 2026, some major changes are set to reshape how it works. One of the biggest reforms is prescription drug pricing. For the first time in history, Medicare will be able to directly negotiate the cost of certain high-demand drugs with pharmaceutical companies. This is a dramatic shift. For decades, drug prices have only gone up, forcing many seniors to ration medicine or sacrifice other expenses. In 2026, price negotiations are expected to reduce costs for widely used prescriptions, meaning seniors may finally pay less at the pharmacy counter. But that is not all. There will also be a cap on annual out-of-pocket spending for prescriptions. No senior will be required to spend more than $2,000 a year on covered drugs. For those battling chronic illnesses such as cancer, heart disease, or diabetes, this cap could be life-changing, saving thousands of dollars every year. However, there is another side to the story. Medicare Advantage plans are funded partly through reimbursements that the government pays to private insurers. In 2026, those payment formulas are being adjusted. Some insurers may receive less money than before, which could lead to higher premiums, reduced perks, or narrower provider networks. In other words, while you may save at the pharmacy, you might face fewer plan choices or smaller networks of doctors. For seniors in rural areas where access to providers is already limited, this could be especially concerning. Oversight and transparency are also increasing. Starting in 2026, Medicare Advantage plans will have stricter rules on how they advertise, how they use prior authorizations, and how they report benefits. This is meant to reduce confusion and protect seniors from misleading marketing. For years, TV commercials and mailers have made it difficult to compare plans honestly. While new oversight is a step toward clarity, it could also create delays in approving certain services, since insurers will face more paperwork and accountability measures. So who benefits the most from these changes? Seniors with high prescription costs will be among the biggest winners. A cancer patient who now pays over $5,000 out of pocket could see their spending drop to no more than $2,000. Seniors on fixed incomes will gain financial relief. On the other hand, those who primarily value dental or vision benefits may notice cutbacks as insurers shift resources to comply with new rules. And healthy seniors may see changes in premiums or copays, even if they do not use expensive medicine. It is important to remember that Medicare Advantage was originally designed to give seniors more options, not fewer. But with every reform, there are trade-offs. The 2026 changes simplify drug costs and add consumer protections, but they also pressure insurers to cut costs elsewhere. That is why it is essential to understand how these reforms affect you personally, rather than assuming they will be universally good or bad. Here is what you should do to prepare. First, stay informed through reliable sources like Medicare.gov or independent advisors who are not tied to a single company. Do not rely only on commercials or mail advertisements. Second, review your current medications. If you take high-cost prescriptions, calculate how much you could save under the $2,000 cap. Third, check your doctors and hospitals. Make sure your preferred providers will remain in network with your plan. Fourth, evaluate which extra benefits matter most to you. If dental, vision, or hearing coverage are important, be sure your plan continues to include them. And finally, plan ahead financially. While you may save money on drugs, premiums could rise in other areas. To put it simply, Medicare Advantage in 2026 represents both opportunity and challenge. On one hand, seniors will finally see long overdue relief from sky-high drug prices and crushing out-of-pocket costs. On the other hand, insurers under financial pressure may cut back on perks or shrink networks, creating new obstacles for access. Whether this feels like progress or frustration depends on where you stand in the system. But one thing is undeniable: 2026 is not the year to ignore your health plan. Every senior enrolled in Medicare Advantage will need to carefully compare options, weigh trade-offs, and make thoughtful decisions. For some, staying put may make sense. For others, switching to a different plan or even back to original Medicare might be smarter. Names like Medicare Advantage can sound abstract, but behind them are real people. Millions of seniors whose health, finances, and peace of mind are at stake. When Congress passed the original Medicare law in the 1960s, the promise was that no American would grow old without health care security. Decades later, Medicare Advantage continues that promise in a different form. But as times change, so does the system. 2026 will be one of those turning points, a moment when choices matter more than ever. So as the changes arrive, remember this: you have the power to protect your coverage and your future. Learn about the reforms, review your options, and ask questions before you decide. Healthcare is personal, and in 2026, your decisions could shape not only your health, but also your financial stability. Change can be confusing, but it can also be empowering if you are prepared. Medicare Advantage 2026 is not just about laws and policies, it is about people. Millions of seniors will be affected. The best way forward is to stay informed, stay proactive, and stay ready. That way, no matter what happens, you will be in control of your healthcare, your costs, and your peace of mind.